Good afternoon. I'm joined by Professor Murphy, the head of the Vaccines Task Force, and we're pleased to give you an update on the COVID-19 progress in Australia. And we'll begin with the fact that the latest advice from the National Incidence Centre is 0 cases of community transmission today. This makes the 50th day this year when Australia has had 0 cases of community transmission, or approximately 62% of days for the year. At the same time, agonisingly, we have seen an uptick in global cases in the last 2 weeks. Very high figures in the last 24 hours for weekend, 399,000 cases worldwide, and agonisingly over 6,000 lives lost. So I think that puts into perspective the extraordinary achievements in Australia, and I want to thank everybody in every part of society, community, the medical profession, the health departments and other government departments across the state and across the country. So thank you to everybody. And also very high testing yesterday of 30,000 tests nationwide, which for a Sunday was an excellent result. If I may turn just to today to remind, Phase 1B begins today. Over 6 million Australians will be invited to participate over the coming weeks and months, and we do reinforce the need for patience and the fact that with approximately 250,000 doses to be made available for this week, that means we all have to recognise there's enough vaccine for every Australian 3 times over, but that very importantly, those vaccines, as it is with the flu or the National Immunisation Program, are distributed over a period of time. But it's we're in a very, very strong position. I want to thank everybody for that. If I may turn to the progress on the vaccination. So what we see is that there are now over 281,500 people that have been vaccinated Australia-wide. In particular, you'll see that there are 58,358 people who have been vaccinated in aged care, if we can just turn to aged care. And of those, over 49,000 are first doses and over 9,000 are second doses. Very importantly, already 609 facilities have had first doses and 89 have had second doses. So good progress around the country with significant ramp up during the course of this week. If we then turn to the Phase 1B rollout, as we say, over 1,000 general practices are due to commence this week. I had the privilege of joining the National Health Co-op in Macquarie today, and to see Joe, our doctor, provide a very steady hand with vaccinating Lynn, our patient. And these vaccinations are occurring around the country today. We're seeing vaccinations in state clinics with regards to a focus on our health workers. We're seeing vaccinations in general practices, and we're seeing vaccinations in Commonwealth respiratory clinics. And I think that it's a signature day for Australia in terms of the vaccine rollout. And I want to thank our GPs. And what we've seen is that many of them are doing longer-term bookings. The Prime Minister and I met with the general practices, with the heads of the RACGP and the Australian Medical Association and many of our rural bodies such as the Australian College of Rural and Remote Medicine and the Rural Doctors Association of Australia on Friday. And all practices are being given 12 weeks confidence with their minimum vaccine supplies, so they have that certainty, and they are free to book for long periods during that. The practice we visited this morning, for example, was making initial bookings right to the end of April, so over a 5-week period, and they're able then to book in many people and to give them that certainty. As well as that, the Commonwealth respiratory clinics are available. If I may, I might now turn to Brendan, and just to remind on the people who are eligible to be vaccinated, and after that he'll also address AstraZeneca and some great news I think on that front globally as well as domestically. Then we'll be happy to take questions.
Thank you, Minister. So just to remind people, those who are eligible to be vaccinated in Phase 1B, you'll recall that we've already started early parts of 1B with healthcare workers and household contacts of healthcare workers in some of the state-run clinics. But this is the really exciting thing where we're rolling out 1B to the general population, initially to the over 70s and those with underlying medical condition and Aboriginal and Torres Strait Islander people 55 years and over. As Minister Hunt said, there are 6 million people in Phase 1B. This is a huge and complex exercise as we roll out over 4,000 points of presence over the next month. Getting vaccines to all of these points of presence is a complicated and sophisticated logistic task. And of course, as new clinics come on board, more appointments will be available and more access will be available. So we do say, as I've said on many occasions, we are rolling out clinics, points of presence and vaccine as soon as we have available vaccine, and I'll come to that in a minute. But that is the major determining factor of the rate of rollout. So we do ask people, I know there's a lot of enthusiasm, which is great in Australia to get vaccinated, but be patient and wait, look at the eligibility checker and wait for appointments to come up. So the particular focus obviously at the moment is on the over 70s and 80s and those with chronic conditions, the more vulnerable population, and we have deliberately sought to vaccinate those people mainly in general practices, because general practices are the place where they are known, they know what their conditions are, and they feel comfortable in that setting. So it is going to be a big exercise, and we're so grateful to those wonderful general practitioners around Australia who have put up their hand to be part of this vaccination program and have started already. Next slide. The AstraZeneca vaccine is our workhorse vaccine. I have said on many occasions how lucky we are to have onshore production of a vaccine. Every country in the world that is dependent on international supplies is facing supply chain challenges. This workhorse vaccine is being produced in Australia, and very excitingly, the TGA only yesterday approved the local production of this vaccine. The vaccine that has been cross-licensed from AstraZeneca to CSL and is being made in Parkville, and increasing doses will be coming off the production line over coming weeks in Parkville. That will provide us with a reliable, steady and progressively increasing source of vaccines so that we can expand our rollout. The TGA hopefully will be releasing the first batches of this vaccine in coming days. The other noise about AstraZeneca vaccine, of course everyone is aware, was the word from the European Medicine Agency that they have reaffirmed that this vaccine is safe and effective. Very important. It is a safe and effective vaccine. In my view, it is as effective as the Pfizer vaccine. The two are indistinguishable, and it is great that we have two wonderful vaccines. TGA have also reaffirmed on the international data the safety and efficacy of this vaccine after the European Medicine Agency decision. Obviously, each batch which is produced in Australia will be tested and be released progressively, but this is now the most exciting development in my mind, is to have locally produced vaccine which we will display and deploy to the population as we get it and as quickly as we can safely do. Last slide. Again, I do want to emphasise the need for patience. It is going to take us some time to vaccinate 6 million people in Phase 1B. We do not have community transmission in Australia. We have the time to do it properly. We're not going slowly, we're going as quickly as we can get vaccines, but we're doing it with safety as the paramount objective, and getting people to the vaccination clinics near their home where we possibly can. So you can continue to look at the website or call the coronavirus helpline, but be patient, wait for appointments to come up. Your time will come We're going to get Australia vaccinated. We have done very well so far, and we're going to continue to improve and expand this program. Thank you.
Happy to take any questions. Rachel?
Minister Hunt, two questions. How many doses are CSL going to distribute this week? Do we have that information?
We'll have the final confirmation once the batch testing is done, but we're on track to be able to meet all of our commitments to all of the states and territories and the general practices over the course of the coming 12 weeks on the latest work that we were doing over the weekend. But they will progressively build towards 1 million. Of course, we have to have the contingency for second doses, but reaffirmed only on Friday that we're in a position to meet all of our distribution commitments. Second question, please.
Are there concerns the pause of AstraZeneca in Europe could have a lasting impact on people's confidence? I know some doctors are contacting patients who are still a bit hesitant because of that blood clot reporting.
Sure. Look, I'll give a view, and then I think Brendan's view is probably more informed on this than mine. But we do know that one of the biggest hesitations in Australia, and I think it's very important to be honest about this, is the question about safety. And there are far more people who have been concerned in our research about the rollout being too fast rather than too slow. The vast majority think that it's on track, but some feel that it's too fast and they want to know about safety, which is why there's constant reaffirmation. We haven't had those debates to the same extent in Australia. Globally, of course, you would all know better than us that the public appetite and the media focus has probably been greater on this specific issue of vaccines than anything I can remember on a sustained basis. So our job is to provide the confidence, and we can say these are safe and effective, and we think the best medical regulator in the world has not only made the decision, reaffirmed it, and then affirmed the Australian production, which gives us the vaccine manufacturing capability. But our medical authorities are strongly supportive.
Yeah, thank you. So obviously these small numbers of cases of a very rare event in Europe have created some attention, and the European agencies are trying to understand them more. But I think the important thing to note is that we have to stick, as Minister Hunt said, with what the regulatory authorities say. The European Medicine Authority has intensely examined this issue, and despite a lot of anxiety in Europe, they have come out with a completely conclusive statement to say that they think this vaccine is safe and effective and should be continued to be rolled out across the whole population. The TGA has done its own independent review of the data. Obviously, we are monitoring data over time, but as you say, whenever there is anxiety, that creates issues with confidence, and we need to inform our health professionals with the best advice so that they can provide that reassurance. I am very confident that this vaccine is safe and effective, otherwise I wouldn't have had it myself.